So good afternoon, Chairman Stone, committee members. My name is Adrian Sanchez, and I am the Health Fellow at the Greenlining Institute, and I'm from Salinas, California. So when I was 10 years old, my mother was diagnosed with chronic lupus disease, a pre-existing condition that made it difficult for my family and I to afford health care and put us in financial need. I have extensive memories of having to miss school and take care of my mom in the hospital, driving her to expensive treatments outside of our hometown, and being a translator between healthcare professionals and my mom. There were mornings when my mom would wake up nearly paralyzed, not feeling her left leg and barely being able to get out of bed. Being the oldest of three in the family, I took on the responsibility of being my mom's primary caretaker, and at 15 began to work to support my family. Living in a home where domestic violence was prevalent and having a father that battled with substance abuse, I felt disengaged in my classes. Worried for my family's life, and most importantly, I was afraid to ask for support because of fear of being removed from my family. At that time, I wanted to be anywhere else but school to ensure the safety of the lives of my family members, so I started to miss school. In 2007, during my senior year of high school, my mom's health began to worsen. My dad was diagnosed with a brain aneurysm and passed away during brain surgery. Not being able to cope with the emotional and mental stress, my mom was also admitted into the hospital. Not having health insurance, my family and I had to fundraise and apply to the hospital's community benefit program to help pay for both my mom and dad's hospital expenses. At this point, I had been missing a lot of school and was falling behind in my classes. The administration had told me that I was in danger of not graduating high school because of my poor attendance. Truth is, I have been having issues both my junior and senior year of high school. I was an honor roll student, worked 30 hours a week, and was still taking care of my mom. I had to make the sacrifice, so I started to go to school more, which meant less money coming into the family with my dad no longer alive. Overwhelmed with financial burdens, our family could no longer afford our mortgage, so we lost our home. We moved into my aunt's 2-bedroom home until my siblings and I left for college. Research by the Vera Institute shows that taking a punitive approach to addressing school absences doesn't always work. The most common responses to teenage chronic absence around the country are punitive, contrary to what adolescent development and school engagement research tells us about what motivates teenagers to attend school. For truant teens, their lives outside of school create additional barriers for them to go to school. It does not make sense to reduce the money of families that need it the most. We are hurting families that are in dire need of CalWORKs assistance and are being punished by this double truancy penalty. What motivated me to go to school was not the threat of a fine. It was knowing that if I did not go to school, I would not be able to go to college and make a better life for my family. AB 814 encourages counties to get to the root of truancy in teenagers so that they can intervene and not penalize them for situations that they cannot control and are trying to make the best out of. There are a multitude of factors that a school district, a legislator, or a school's police officer does not know about when considering whether or not to implement a truancy fine. I urge your aye vote on AB 814, which will move us forward into getting to the root cause of the problem. Thank you.
Thank you.